Hi, this is Bashar J Qumseya. I'm very excited today to share with you the results of our most recent meta-analysis, which will be published in Gastrointestinal Endoscopy, regarding the use of endoscopic ultrasound among patients with Barrett's esophagus. As you know, endoscopic ultrasound has long been used for staging of esophageal adenocarcinoma. However, its use among patients with Barrett's esophagus has been controversial. We know that staging is important because if the tumor is advanced, that is, if it invades into the submucosa or staged at more or equal to T1SM, or if there is lymph node involvement, that is, more or equal to N1, then endoscopic therapy like endoscopic mucosal resection and endoscopic submucosal dissection may not be warranted. Therefore, we decided to conduct a systematic review and meta-analysis of all relevant studies. And the goal was to define the proportion of patients, for those patients who have Barrett's esophagus and who are referred for high-grade dysplasia and early adenocarcinoma, in whom performing endoscopic ultrasound would result in a change in the therapeutic approach for those patients. That is, those patients will be identified as having T1SM or more, N1 or more on endoscopic ultrasound. We hypothesize that performing endoscopic ultrasound will result in a change in the therapeutic approach in a significant minority of those patients. The estimate of interest in this study was, again, the proportion of patients who had advanced esophageal adenocarcinoma as identified by endoscopic ultrasound among all patients who were referred for Barrett esophagus and high-grade dysplasia or early adenocarcinoma. The results were based on EMR, fine needle aspiration, and/or esophagectomy. We also wanted to look at secondary outcomes like the proportion of patients who had advanced disease detected on endoscopic ultrasound in the absence of any visible lesions on EGD. Our literature search resulted in 1,278 studies. Of those, 47 studies were reviewed in full detail and 11 studies were included in the final analysis. Those 11 studies contained information on 656 patients which were seen between 2001 and 2012. Our meta-analysis showed that the pooled proportion of patients who had advanced disease detected on endoscopic ultrasound was 14%, with a 95% confidence interval between 8 and 22% and a significant p-value of less than 0.0001. Therefore, what this study shows is that among patients with Barrett's esophagus who have high-grade dysplasia, early adenocarcinoma, or nodular Barrett's esophagus, endoscopic ultrasound will identify 14% of all comers with advanced disease which would not be amenable for endoscopic treatment and could result in an appropriate change in the therapeutic approach. Based on this analysis, the number needed to treat was found to be 7. That is, the number of endoscopic ultrasounds need to be performed in order to diagnose one case with advanced disease was 7. To look for publication bias, we used a classic fail-safe test, and we showed that we need 553 null studies for the p-value in our analysis to exceed 0.05. For the secondary outcomes, we reviewed 7 studies that reported the presence or absence of visible nodules, ulcers, or strictures at the time of EGD. For those studies, we showed that the pooled proportion of patients with advanced disease on endoscopic ultrasound in the absence of nodules on EGD was 4%, with a 95% confidence interval between 2 and 6% and a significant p-value. In conclusion, a significant minority of patients with Barrett esophagus who are referred to your clinic for evaluation of high-grade dysplasia or early adenocarcinoma will have advanced disease that will be detected by endoscopic ultrasound. Additionally, of all patients, 4% will be found to have advanced disease on endoscopic ultrasound despite the lack of any visible nodules or lesions on EGD. The findings of our meta-analysis should be carefully considered before endoscopic ultrasound is excluded from the workup of patients with Barrett esophagus. In addition, we need to have a better understanding of the cost effectiveness of endoscopic ultrasound given this low yet significant yield for this indication. Thank you very much, and I hope you enjoyed the article. Please feel free to email us if you have any questions regarding this meta-analysis.